morning, students. After learning the vertebral column in the first video on thoracic skeleton, we have learned the second video on the typical feature of a vertebra, and this is the third video in the thoracic regions, on the osteology of the thoracic region. Now in this short video, we will learn about the bones which forms the thoracic region, and then we will come on to the description of the sternum. So let us see which are the bones which forms the thoracic region. Now the skeleton of the thoracic region is formed by a bony cage, and this is like a cage, and it encloses the three important structures, right and left lung and the heart. So it protects the heart. The lower part of the thoracic cage is also protecting to the upper organs of the abdominal cavity, deep to the diaphragm, that is the stomach and the liver. If we come back to the thoracic region, we will see that the cage is formed by the following bones. Which are those following bones which forms the thoracic cage? It is formed by the thoracic vertebrae and the intervertebral disc between the thoracic vertebrae. There are 12 thoracic vertebrae and there are 11 intervertebral discs which joins these 12 thoracic vertebrae. This forms the cage on posterior aspect. Then from the vertebrae there comes the anterolaterally the ribs, and anteriorly there is the presence of the costal cartilage. Thus there are 12 ribs, 12 pairs, 12 on right side and 12 on left side, and the anterior end of these ribs is having the costal cartilaginous end. And these ribs and costal cartilage anteriorly they articulate with that of the bone that is called as the sternum. This is the figure of the sternum. Now I will show you a thoracic cage, and how the thoracic cage is formed from my own book on osteology. Now this is the book, the Human Osteology, published by P.P. And from this book, I will show you the thoracic cage. Let me just zoom this diagram of the thoracic cage. Now you can see the thoracic cage here, posteriorly, which is formed by the vertebral column, thoracic vertebrae, 12 thoracic vertebrae. Most anteriorly it is formed by, this is the sternum, and from vertebrae to the sternum, the ribs are coming on both the side, right side and left side. Thus these three bony structures, they form the thoracic cage. This is the inlet of the thorax, and this will be the outlet of the thorax. Within this thoracic cage is presence of the two lungs, right lung, the left lung, and in the middle of the two, behind the sternum lies the heart. It is the heart. Now if you cut a section, or if you see just one single segment of the thoracic cage, you will see that, as I said, posteriorly it is formed by the thoracic vertebrae, to which are the right and left ribs are articulating, and the anterior end of the right and left ribs is formed by the costal cartilages, which articulates with that of the bone on the front anterior aspect, that is sternum. Thus three bones which forms the thoracic cage is the vertebrae, 12 thoracic vertebrae, 12 pairs of the ribs, and then a bone in the anteriorly, that which is located, is called as the sternum. Thus you have understood that how the thoracic cage is formed. With this introduction, we come to the first bone of this thoracic cage, and that is the sternum. So I will now describe in short about the sternum, which is also sometimes called as the breastbone. Now this bone is located anteriorly. If you see this bone, this is located anteriorly in the thoracic cage, and this is a flat bone. this is a flat bone which posteriorly, it articulates on its lateral margin with the costal cartilages, as we have seen in the thoracic case. It is about 6 inches long. This sternum is about 6 inches long. Now, if you will see the sternum, this is formed by the 3 different pieces of bone, and this has 3 parts are named as, this is the uppermost part, that is called as the manubrium sterni. This is called as the manubrium sterni, or just simply you call it as the manubrium. Second long part is formed by that of the body of sternum. This is called as body of sternum. And then a small triangular piece which is near at the end, inferior end of this sternum is called as the G.P. sternum. This is now known as G.P. sternum. Just note down, draw a rough diagram and note down the 3 different parts of the sternum, 3 different parts of the sternum. Now let us come first to the description of this manubrium sterni, or just simply the manubrium. Now if you will see the manubrium here up to this portion, it is the manubrium, and if you will see the upper border of this manubrium, this is called as a sternal notch. There is a notch, which is concave upward, sternal notch. This is known as sternal notch, right? Then just on to the lateral side of an inferior side of this sternal notch, right, and on left side there is another notch is seen, and this is called as clavicular notch. It is known as clavicular notch. And this clavicular notch, if you will see it, this will articulate, on right side as well as on left side with the bone called as the clavicle. So it articulates with the bone called as the clavicle to form an articulation with the medial end of the clavicle, and that articulation will be called as sternoclavicular joint. That will be called as sternoclavicular joint on right side as well as onto the left side. Now then this manubrium is having another notch just beneath that of the clavicular notch, and this notch is called as costal notch. This is called as costal notch because it gives attachment to the first costal cartilage. Right, this here, this gives attachment to the first costal cartilage. I will just write with the blue color because it is the costal cartilage. So there will be the costal cartilage. Now the joint between this costal notch, that of manubrium, and that of the first costal cartilage is primary cartilaginous joint. That you should remember, It is primary cartilaginous joint. Then this manubrium, lower end of the manubrium sterni will articulate with the upper end of the body of the sternum at this joint, and this is called as manubrium sternal joint. Manubriosternal joint. Now this joint, manubriosternal joint, is slightly raised. It can be felt subcutaneously. Because it lies just beneath the skin. This is the raised joint. If I draw it here, this joint, by cutting a longitudinal section, this will be the manubrium and this will be the sternum. Just a minute. This will be the sternum of the manubrium. So this joint is raised here at it makes an angle. And because of this manubriosternal, which is at an angle, this joint is sometimes called as the angle of Louis, Louis. Please note down, angle of Lewis or sternal angle. Okay, in simple word, you can call a joint between the manubrum and that of the body of the sternum as sternal angle, which is raised and which you can always feel with the help of your finger, which because it lies just beneath the skin. Okay, and this one articulates at the junction here, this joint that is upper end of the body of the sternum, and this it articulates with the second costal cartilage, but this joint here, okay, the joint between the costal cartilage and the other subsequent joint, costal joints, which will be for that of the third, the fourth, the fifth, the sixth, and the seventh, all these costal cartilages, they will join the margin of the sternum here, and the second will join with that of the manubrum and the upper end of the sternum by forming a synovial joint. So that is the difference. Here it was primary cartilaginous joint, the rest of the joint of the costal cartilage with that of the lateral margin of the sternum, they are the synovial joint. Right? So the 7 costal cartilages will articulate on the margin of the sternum, okay, on the margin. Now, since this angle of Lewis or the sternal angle is raised and it is easily palpable by the fingers, lies just deep to the skin, thus this fact is utilized because we know that at this angle the second costal cartilage articulates here. So this is used for the counting of the ribs. Once you have just felt the sternal angle, then feel the costal cartilage and then keep on counting the ribs, okay, in the infralateral direction. Don't go directly downward counting them, go infralateral, because here as the costal cartilages come towards the lateral margin of the sternum, they come close to each other. So there may be a difficulty in counting it, but they spread up as the ribs goes towards the lateral side. So this is always counted in infralateral direction, and thus you can count the intercostal spaces also. Okay, intercostal spaces. This will be very helpful in clinical conditions where ECG is recorded or injections are made into the pericardium. So this intercostal spaces to count is very important, and this is the way how it is counted. Okay, how it is counted. Now this sternum, if you see onto the description of the body of the sternum, it is a long and thin plate of bone, okay, covered on either side by the thin plate of the compact bone, while the manubrum was a thicker bone as compared to that of the body of the sternum. It was a thicker bone, and I showed you that on its lateral margin on left side and right side, it forms the costal notches for second to the seventh costal cartilage, 7 to the second, and they form the this synovial joint, okay, synovial joint. Now come to the third part of the sternum, and that is called as the GP sternum, and this is the smallest triangular structure, okay, smallest triangular structure, and this form a joint with that of the body of the sternum, and this is called as GP sternal joint. GP sternal joint, okay. So this is the GP sternal joint. This was the sternal angle, okay. Manubro-sternal joint. This is GP sternal joint is here. Now this is cartilaginous. That means gypoid process, which is a small triangular piece, it is cartilaginous, okay. At birth and for the first 3 years it is cartilaginous. Then in the 3rd year of age it starts ossification, and ossification is completed by the end of 40 years. That means then it will unite with the body of the sternum as it becomes completely ossified. So these are the 3 bones of the, I would say, parts of the sternum the manubrum, the body of the sternum, and the Ziphioid process. Okay, Ziphioid. This is only supported by the medial end of the clavicle and by the costal, 7 costal cartilages. Otherwise, it is a free bone, only supported by clavicle and the costal cartilages. Now, let us come to the muscular attachment of this structure. Okay, if you will see the attachment of the muscle onto this bone, there are two muscle on anterior aspect which are attached to it. Okay, which are these two muscle? One is elongated extension, and this elongated extension from the clavicular notch, it runs onto the lateral margin right up to the 6th costal or 7th costal cartilage, and that this area gives the attachment to the muscle called as the pectoralis major. This is the external head of the pectoralis major muscle. So this is the pectoralis major muscle, as you must have read. So this is the origin of pectoralis, right from the manubrum right up to the lower end of the body of the body of the sternum. This is the attachment of. Then there is another muscle which also take origin, and it is the external head of the sternocleidomastoid. So this was pectoralis major, and this is second muscle, that is the sternocleidomastoid, that is which had sternal, because it is taking origin from the anterior aspect of the sternum. So it is the external head of the sternocleidomastoid. There is attachment of a strong ligament. Let me find the correct to the tip of the Ziphioid process, and this is called as the linea alba, which is a median ligament for the attachment of the muscle of the abdomen, and this gives also attachment to that of the linea alba and to the rectus abdominis muscle anterior aspect. So from this area there is the insertion of the rectus abdominis muscle, okay, from this, and then there is the attachment of the aponeurosis of the external oblique muscle. So aponeurosis of external oblique and that of the linea alba and that of the rectus abdominis is also attached onto the lower part of the sternum, is usually mostly to the Ziphioid process, okay, and its lateral margin. Let us go to the structures which are attached on its posterior aspect. Let me have the other diagram for posterior. Suppose we are seeing the sternum and costal cartilages from the posterior aspect. These are 7 costal cartilages. Let us see what are the muscle attached on the posterior aspect of the manubrum. This is a horizontal band of the muscle is sternohyoid, and then there is another band of the muscle which is a ribbon muscle, the sternothyroid. So the lower one attached onto the posterior aspect of the manubrum sterni is sternothyroid, and the upper one is the sternohyoid, going up to the hyoid bone, and this will go up to the thyroid, okay. So it will lie behind the sternohyoid, which will go to a higher level, so it has to lie anteriorly, and deep to it will lie the sternothyroid, okay, sternothyroid, and this is the sternohyoid muscle. One more muscle takes origin from the posterior aspect of the body of the sternum, okay, in its lower and lateral part, and this muscle is partly also takes origin from Ziphioid process posterior aspect, and this muscle is called as sternocostalis. Because from sternum it will go to the costal cartilage upwards, okay, and to the rib also. And so this is the sternocostalis muscle taking origin from the lower part of the body and the sternum. Now I will like to tell you also two important reflection of pleura on right side and on to the left side. Since we are seeing the sternum from behind, posterior, it will be left, and this is the right side, okay. This is the right side and this is the left side of the sternum. On the left side, because there is a presence of the heart here, now the reflection of the pleura will deviate more towards the left side. Now this pleural line, the pleura will lie first and will start reflecting. The examiner may ask you with the chalk to draw this line onto the sternum during the examination. So start your drawing right from the clavicular notch, okay. So this was clavicular notch on the left side, then come very close to the median plane, keep on drawing, and then this will be reflecting by the side of the lower margin of the fourth, okay, costal, attachment of costal. So this is how the pleura will be related onto the left side, okay. This is the reflection of the pleura onto the, because of the presence of the heart here, okay, onto the left side. But when you will be asked to draw by examiner, to draw it, then it starts onto the right side from that of the this clavicular notch, come very close to the median plane, okay, and then go right up to the lower end of the body of the sternum, at least up to the sixth costal cartilage. And this is the reflection of the right pleura. So that, see the difference between the reflection of the right pleura and that of the left pleura. That you should keep it in mind, okay. This difference is because of the presence of the heart, okay, because of the presence of heart. Okay, let me come now to the ossification. Once you have understood the body, bony features, and you have understood also about the, particular features, means the attachment of the muscles, then you come on to the ossification. And for ossification, okay, I want to say that in the ossification, the sternum ossifies by two separate plates on which the costal cartilages are attached. So we are seeing it from front, so it is right side and this is the left. So these are the two costal cartilages which forms the plate-like elongated structure for the sternum from right side. Then they come to the midline and start fusing from above downward, okay. And thus after fusion they will form the model of the sternum, okay, cartilaginous model of the sternum, which is completely fused. And here, just since we have to see its ossification in three different parts, I have just shown this costal, this articular, this hyaline cartilaginous model of the sternum, which has been formed by the fusion of the two plates of right side and left side. And this plate after fusion will have the complete model of sternum as costal cartilage, okay. Then the two centers of ossification will appear in the manubrum part of the costal cartilage, and these two centers will appear in the fifth month, not week, okay, fifth month of intrauterine life, okay, before birth. And soon they will form a single center to form the bone of the manubrum. Similarly, here to begin with, the body of the sternum is present in 4 pieces, okay, and these are the 4 pieces and they are joined, okay. They will show the presence of a primary center again in the fifth month. This is the 5th month. Second segment also in the 5th month, and then the 3rd and 4th segment will have the double ossification center, and this will appear in both will appear in the 6th month. They will appear in the 6th month. And for G.P process, I have told you that it is cartilaginous till early childhood, and only in the 3rd year after birth their ossification center will appear. Okay. Now this center of the 5th and the 6th month, which are for the body, they will form the bone, and in between them will remain the cartilaginous plate. Okay, this line will be still cartilaginous, so it can grow of the ossification epiphyseal line, and the body will start growing. Okay, will grow as per the age, and then these pieces of the bone which have formed, they will start fusing, and they will start fusing as the puberty will approach, and this keep on fusing till 25th year of age. So at puberty they will start fusing with each other and will keep on fusing till 25th year of age. So what does it mean? After 25th year of age, the whole body is a single piece of bone. Okay, though you can still feel the lines at the junction. Okay, the ridge is seen. Okay, in between the 3 ridges are seen between these 4 pieces. Now then this will unite. Okay, this will fuse. Okay, that is manubrum, and between the body of the sternum, that is this manubro-sternal joint. Okay, and this is still not fused. That means manubrum has not fused with that of the body of the, still it is a fibro-cartilaginous joint. Manubrum, it's a symphysial joint is here, and this will fuse at the age of 60 years. Okay, this is necessary because some movements takes place between manubrum and the body of the sternum, which after 60 years will not be possible. That means which movements? Movements of respiration. Okay. Similarly, as I said that for G.P process, a center will appear in the 3rd year, which will fuse with that of the lower end of the body of the sternum, body of the sternum at the 40 years of age. Okay, at the 40 years of age. That means after 60 years it will be complete piece of bone. That means there will be no separate manubrum, no separate body or G.P. That will form a single piece. Okay, after 60 years. Quickly I will come to that of the applied importance of the sternum, applied anatomy. Okay, and in applied anatomy, what we can say is that during most of the surgeries of the thoracic cavity, okay, the thoracic cavity is opened by giving a vertical incision, okay, in the midline, so that you separate the sternum, body of sternum, manubrum and G.P. into 2 pieces, and then you can stretch it towards the lateral side so the wide gap is open. Okay, and this is the procedure for that of the any intrathoracic operations, that mostly it is used. Okay, midline incision is used. That means a sternum is cut to do the bypass surgeries on the heart. Okay, a bypass surgery on the heart. Then second applied importance is that since sternum is covered by only a thin piece of compact bone, and then deep to it lies the bone marrow. So if one want to check a sample of the bone marrow for examination, this is the most superficial bone situated just deep to the skin, where the compact bone is very thin, so you can take out the bone marrow, okay, from the body of the sternum very easily for examination. So for bone marrow biopsy it is taken. Okay, now some of authors have reported that the sternum morphology or structure is different in male and female. Its dimensions, length, width, they are different in male. So some of them have used this bone as for the sex determination purpose also. And since I have told you in the beginning that this sternum develops by the fusion of the 2 plates, okay, right and left plates, okay, so that sometime when the right and left plate of the sternum they don't fuse completely with each other, and there remains a gap. Okay, there will. And through this gap, then the pericardium will also not form, so that you can see the heart beating. Okay, because anterior chest wall is not formed. So the bone is not formed, then the skin is not formed, pericardium is not formed. So the heart can be seen beating, okay, from the chest wall. This condition is called as ectopia cordis. Ectopia cordis. And last